What structure does the straight arrow point at? On this coronal CT of the chest, we see tubular and branching Y and V-shaped structures resembling a gloved finger. There appears to be secretions within adjacent bronchi. The answer is a bronchocele. Now, what the heck is a bronchocele? Well, a bronchocele is bronchial dilation due to retained secretions, i.e. mucoid impaction, and is usually caused by proximal obstruction, either congenital, such as from bronchial atresia, or acquired, such as from an obstructing cancer. A bronchocele is a tubular or branching Y or V-shaped structure. It resembles a gloved finger, as seen here. The CT attenuation of the mucus is generally that of a soft tissue, but may be modified by its composition, such as high attenuating material in ABPA, allergic bronchopulmonary aspergillosis. In the case of bronchial atresia, the surrounding lung may be of decreased attenuation because of reduced ventilation and thus perfusion. For example, on this axial CT, at 11 months of age, the left lower lobe demonstrates an area of hyperlucency. The straight arrow points to a tubular density, a bronchocele, within this lucent region, near to and larger than adjacent vessels. The differential for bronchocele is vast. ABPA is the most common cause, but other types include congenital lobar overinflation, CLO, congenital pulmonary airway malformation, CPAM, bronchogenic cyst, bronchopulmonary sequestration, scimitar syndrome, i.e. hypogenetic lung syndrome. A slow-growing endobronchial tumor is also in the differential. Aeration of the distal lung may occur through collateral air drift, and components of atretic bronchi are frequently found pathologically in other congenital lung lesions, and it may be within the spectrum of CLO, CPAM, BPS, and bronchogenic cyst, as mentioned. Clinically, older children and some adults are typically asymptomatic, but they may present with recurrent respiratory tract infections, including chronic cough, shortness of breath, and/or wheezing, especially in early childhood. Resection is usually reserved for very recurrent infections. You now know a ton about bronchoceles. Please subscribe for more awesome anatomy and radiology videos.